Hey, 12, everybody. So respiratory illnesses continue to remain a public health threat, right? Despite the newly relaxed guidelines released by the CDC last week.
Yeah, and add to that a slight uptick in measles cases across the country and 2 cases right here in New York. New York City Health Commissioner Dr. Ashwin Vasan joining us now this morning with what this means for us. So good morning, Commissioner. Thanks for being with us.
Thanks for having me. It's always good to be here.
It's so weird to hear measles, but we do have 2 cases in the city, right? Are they children, adults?
Well, we can't really share a lot of details about personal details about the cases,
Yeah.
but I can tell you this: they're not connected. They were
Okay.
separated by about a month, and they're both related to international travel.
I see.
Recent international travel. Measles, as you know, is an extraordinarily infectious disease. You can walk by someone with measles and catch it. That's how catchy this is.
Wow.
That's how
Right.
infectious this is. And we, for many, many years, because of the wall of vaccination we've built up, mostly through childhood vaccinations, we were at the point where measles was eliminated in New York City. But we're seeing some real backsliding across the country. And New York is no exception. We're lucky that those cases that we reported were sporadic. There's no bigger outbreak because we still have a fairly high level of immunity. And our public health system, our agencies are working hard to make sure that we maintain what we have. But all across this country, we're seeing backsliding on childhood vaccinations. And we're even seeing public health officials in places like Florida be part of the problem instead of part of the solution. It's unacceptable.
Well, the cases are up for measles nationwide, right? And New York City, of course, the travel capital of the world, really, right? So when you see the cases around the country and then you see the vaccination rates around the country, are you worried that those 2 cases here could go up? And what's the best line of defense?
Vaccination, vaccination, vaccination. Staying up to date, parents getting their kids up to date on all their routine childhood immunizations, getting ready for school each year, making sure that they're up to date.
Yeah.
Though that's the best wall of protection.
Are you worried that
Most
people
adults,
have vaccine exhaustion, though, overall?
Well, I think that's true. I mean, the misinformation and anti-science movement that built up, that's been building up, but really exploded during COVID, has had this contagion effect that's really calling into question amongst people who don't believe in science, why should I be getting vaccinated for anything? Because I have questions about the COVID vaccine. Couldn't be further from the truth, right? Not only is the COVID vaccine effective and safe and has saved many, many lives in this city and across this nation and world, but the vaccines we've grown to trust over decades to get all of these diseases into memories of the past.
Yeah.
We need to keep up our commitment to science and those vaccinations.
But with everything spreading, and you talk about how susceptible people are, how easily you can catch measles, you think, oh, should we be wearing masks again? But then you hear COVID guidelines are scaling back, and if you don't have symptoms within 24 hours, you can go back to work. I know it's not the same for health.
Yeah, they're all, everything's really different, right? I mean, each of these diseases is different. The fact that we don't have measles cases, most years we have a sporadic measles case or 2. This year we had 2. During COVID we had 0. Prior to 2019 we had maybe 1 or 0 each year. That's where we are now because we still have high rates of vaccination. So I want to reassure New Yorkers, measles is not an imminent threat here in New York, but what we're seeing across the nation is that it's becoming one, places like Florida in particular. But COVID guidelines, and actually this is respiratory virus guidance, is starting to evolve to match the way we live and to match the current level of risk. We have high levels of immunity to COVID throughout New York City and throughout this country because of vaccination levels, because of prior infections. And that's meaning that it's no longer quite as severe for the vast majority of the population. So people can get back to their routines, get back to work, get back to school within 24 hours of their symptoms improving and being fever-free. But
If their place allows it. Because like in a healthcare setting, you're keeping strict guidelines.
Yeah, healthcare settings have not changed. And that makes sense, right? Not only are healthcare workers essential, but the patients in healthcare settings are vulnerable. School guidance will be specific, but we don't think it should be vastly different because we know kids' risk and adult risk is actually less.
Yeah.
But what we're saying is that we're trying to incorporate respiratory virus guidance into the way we already live, which is that people want to get back to their daily lives. In the pre-COVID times, sometimes we'd come to work with the sniffle or a cough. But to be clear, we are saying still take clear precautions, right? Wearing a mask for 5 days, even after you're feeling better when you go to work, opening those windows, hand hygiene, and avoiding contact with vulnerable people, with people who are over 65 or people whom you know have underlying health conditions. If you're riding the subway after being sick, but you're improving, wear that mask. It's a safe thing to do.
Yeah. I do want to ask you a quick question about social media right now, because you were driving the force here with this lawsuit now against the social media companies. We've talked a lot about the damage that social media can do for a young person, but what is the latest of the lawsuit, and what did you really hope to obtain from it?
Well, look, this lawsuit is New York City's statement that we are demanding that the companies start to take action and reform the way they work. No one is saying get rid of social media. Yeah. It's not a possibility. What we are saying is this law, sometimes you can't get what you need by asking nicely. You have to actually use the tools of the law, and over 400 jurisdictions across this country are doing the same exact thing. New York City just happens to be the biggest and the boldest, but we're joining a national, what's called a multi-district litigation, which is based in the Northern District of, in the Northern District of California, right? So there's a groundswell of support with parents, school teachers, adults, caregivers saying, we demand action from the tech companies to keep our kids safe because we're in a youth mental health crisis. And this is one tool in the toolkit, but we launched an action plan on the same day, which also talks about resources for parents, resources for young people, pediatricians, teachers, to start to reshape our relationship with social media into healthier behaviors, reduce our time, but also really understand what content is more harmful than others, and so forth.
And well, as parents, we hope that will make a positive
Yeah, me
impact.
too.
Dr. Vasan, thanks so much for coming in
Thank
this
you.
morning. Stay healthy.
You too.
Yes.